Hey everyone, traditionally diagnosing autoimmune disease has been a very long process. On today's episode, we are so excited to talk about a revolutionary technology that's going to change the way these diseases are diagnosed. Hi, welcome to Health Journeys, a podcast about real human experiences in health and medicine. I am your host and healthcare advocate, Maritza Hasty. Health Journeys is all about discussing the diagnosis and treatments of diseases and exploring personal stories in pursuit of overall health and well-being from different points of view. Support for this podcast comes from Hasty Storytelling. Hasty Storytelling is a creative agency that specializes in production, brand strategy, and live streaming solutions. For more information, visit us at hastystorytelling.com. Hey everyone, welcome to Health Journeys. On today's episode, we are going to talk about autoimmune diseases. Traditionally, diseases like Sjogren's, Crohn's disease, rheumatoid arthritis have been so difficult to diagnose. On today's episode, we're going to be speaking with Dr. David Wong from the UCLA School of Dentistry, and he is going to share with us a revolutionary new technology that's going to drastically change how we diagnose these diseases. Hi, Dr. Wong. Welcome to the show.
Hi, Maritza. Good to be with you.
Thank you so much
Thanks
for
having
joining
me here.
us. Absolutely. Can you, first of all, before we even begin, can you tell us your full title so that our listening audience knows exactly who you are and what you do?
Certainly. So my name is David Wong. I am a professor at the UCLA School of Dentistry. I'm also the Associate Dean of Research at UCLA as well.
Wonderful. So can you now tell us a little bit about your background and your area of specialty and
Sure.
where you are today?
So I am a dentist by training. I did my graduate training in cancer biology and pathology at Harvard University, and then I moved to UCLA 14 years ago, and happily here ever since. Mm-hmm.
Wonderful. So when you were in dentistry, what was it that led you to focus in immunology? How did that transition come about?
Well, that's a very, very intriguing question. So I'll answer you this way. So there are a number of defining moments when I started my schooling, so to speak. I was trained as a dentist, but since sophomore year in college, I was captivated about academic research. I was in the lab of an organic chemist, Professor Kiesler, and I found myself working in his lab for 3 summers, synthesizing insect pheromones. But the real defining moment is when I finished dental school and I decided I will go to graduate school. And the day that I landed in Logan Airport in Boston, Massachusetts, Maritza, that was the year the first human cancer gene was discovered by Robert Weinberg at MIT, Jeffrey Cooper at Dana-Farber, and Michael Wigler at Cold Spring Harbor. And I said to myself, if I were to go through 6 or 7 years of graduate training, this is what I need to learn, how to go into a cancer cell and amongst all the genes that are expressed about a cell, to grab that copy of the genes that can turn a normal cell into a cancer cell. That's what I did. That was a defining moment. And the journey that took me, so to speak, from cancer to Sjogren is one that when I moved to UCLA, and it is this journey of what I call saliva diagnostics, and that's a journey we'll talk about today.
Yes, absolutely. So let's break it down for our listening audience, because when we talk about cancer, when we talk about autoimmune, obviously it's the immune system. So can you, for educational purposes, just kind of take us to what is the role of the immune system and what is happening when a patient has autoimmune disease?
Sure. So the immune system is our own body's defense system against, pathogens or foreign entities, and in this time and day as COVID-19 is no better example than that. So the autoimmune disease, on the other hand, is our own body's defense system, same defense system that turn against our own self. So in the case of autoimmune disease, rheumatoid arthritis or Sjogren, which I think is going to be our topic today, is our own body immune system that turn against these nuclear antigens that are released by tissues that produces saliva, or these tissue that produce tears in our body. These autoantigen called anti-SSA or SSA or SSB, our own immune system develop a autoimmune defense against those. So it's destructive in that sense.
So, Dr. Wong, basically what you're saying is that our own body is mounting a war against itself, so to speak. Would you agree with that? Okay.
Absolutely, and that's a real unfortunate scenario, and you can only imagine what sequelae that will lead to, because you're basically you're your own worst enemy. So
Absolutely.
Indeed.
So, Dr. Wong, in the past, there has been some speculation as to how this happens. Sometimes I've heard that it could be triggered by a virus. It could be triggered by some sort of trauma. I've heard that even things like pregnancy can set autoimmune disease. Do you have any thoughts, or can you tell us a little bit about your experience with, your thoughts on how this whole thing even happens?
That question is a very important one, and perhaps the best way to answer that is that all of the above, all those you mentioned, and perhaps others. There's very little known about the etiology or how the disease started. It could be a viral etiology, Epstein-Barr virus, and others, and all of these could lead to a sequelae that are similar in its outcome. So that's our own body's destruction of its own tissues from the salivary gland, and that's why you have dry mouth, and tear gland, that's why you have dry eye. But the unfortunate scenario is that these are all leading to the same sequelae and an outcome, and that's where the scientists are actively working on, and still is. In terms of treatment, in terms of understanding, and in our case, Maritza, early detection.
Yes.
The ability to find it out earlier.
So before we get to early detection, so now we're going to be a little bit more focused. So let's focus on Sjogren's, which is one of many autoimmune diseases. Can you tell us what is happening to the body? What kinds of things is the patient experiencing? I know you touched on it, but just so that our listeners, maybe they're experiencing some of these symptoms, can you kind of zero in on what is happening to the patient?
So Sjogren is the second most common chronic autoimmune disease in human. And in the US, it affects 4 million Americans, and the majority of them, 9 to 1, are women. So it has a very disparate, gender ratio. The underlying, cause of disease, as we mentioned, is still unknown. It could be viral. It could be a number of etiological factors, but perhaps the underlying, pathological, mechanism is the body's mounting an immune response against the moisture producing glands in our body. So that's the salivary gland, that's the lacrimal gland, the tear producing gland, and in a summation fashion leading to dry eye, dry mouth, and now here's one sequelae that we rarely talk about, but is perhaps the most important one, and that is in 5% of these individuals they develop lymphoma of the salivary gland, and that's a fatal sequelae. And so in addition to finding out and sort of halting the progression of diseases is an early detection of lymphoma that affects 5 to 10% of these patients.
Yeah, no, very, very interesting, and again, early detection as in a variety of different disease states. So how did researchers actually decide, or how did they figure out that the saliva in the body is an indicator to this disease? How did that all come about?
So the sort of integration of saliva into early detection is perhaps the best way to put it is, I won't call it serendipity, but it's sort of where I guess the science progression and how investigators, especially those from a background, because these patients are showing up in dentist's office, are showing up in oral surgeon's office, in addition to rheumatologists and ophthalmologists. So the current sort of clinical criteria for diagnosing, if you will, of the disease is a combination of clinical criteria from eye symptoms to salivary flow symptoms to these autoantibodies that we talked about earlier, these autoantigen that our body mounting to it. So I think the interesting entry point that I think led to my conversation with you and your audience today is that in our research that we found an entry point of what we do. Okay, now I'm trained as a cancer biologist, but because we work on saliva, and there was a discovery 6 years ago that led us into evaluating whether a scientific principle that we unravel between blood and saliva and addressing that question. And we'll talk about this, and that sort of led us into this very intriguing field, Maritza.
Yes, I know in our discussions you even showed some parallels between saliva and blood and serum, and how these diseases can be detected with amazing specificity. So again, can you maybe tell us a little bit about that when we compare,
Absolutely.
Saliva to blood and what you're seeing?
Absolutely. So let me tell you what we found, and this is really what I think the power of science. This is what dental science can bring to medicine. So when I moved to UCLA 14 years ago, one of the 27 institute in the NIH called the Dental and Craniofacial Institute, which carries out most of the research in oral health research and dental research, and initiated a set of initiatives to basically do the following: to turn saliva into a clinical reality. Okay, saliva is always there, but it is not in clinical practice, and the question could be asked why, and we're not here to answer today, but there are multiple reasons. But what NIH wants to do is credential saliva and advance it towards clinical utility, because this is a body fluid that each one of us produce 2 soda cans a day. Okay,
Wow.
that comes into oral cavity. That's non-invasively, non-painfully, and non-embarrassingly, that we can harness and monitor these disease-specific information that is in blood. It's also in cerebrospinal fluid, but it's also in saliva. So this non-invasive capability that you can continuously to harness is clearly is an advantage. So one of the initiatives that NIH put out to do is look at all the proteins that are in saliva. Okay, so the idea is that if you find out all the proteins in healthy people's saliva, in yours and mine, and every UCLA student here on campus, then we can compare that saliva proteomic catalog of healthy people, and then compare with people that have diseases, people that have cancer, people that have diabetes, or people that have Sjogren. Now here comes an interesting situation here is that after we have deciphered, if you will, a catalog all the proteins in saliva, we did a project with Dr. Gil Oman at University of Michigan. He is a world expert in all the proteins in blood. So Dr. Oman basically said to me and David, you have the saliva protein catalog, we have the blood catalog. Why don't we compare them? Okay, because these are like adjacent, biofluid. They should have commonalities and also differences. We did that, and Maritza, amongst all the things that are very interesting that emerged from that study, things out in my mind that really caught my attention. These antibodies called immunoglobulins, which is also the autoimmune, sort of substance in our body that attack ourselves.
Yes.
IgG, IgA, or IgM, their distribution between blood and saliva is almost the same.
So, Dr. Wong, that is fascinating news to know that the component of saliva, the proteins in
Yes.
saliva, can be so
Yes.
so similar to the ones in blood. I mean, it has so many implications. So, when patients then when patients are getting tested, so basically they don't really have to have blood work. They can just have a sample of their saliva, and now you're saying that it can translate to other diseases, to cancers, that's very fascinating. Can you expand a little bit about that?
Absolutely. So it's not all proteins, only the antibodies.
I see.
The antibodies.
Okay. The antibodies. Okay.
And that's our armamentarium. That's our toolbox to fight against pathogens.
Even COVID.
Well,
Yeah.
if there's time today, I gotta tell you something really, really exciting, Maritza. But that's sort of. But hey, dude, people with antibody to COVID, they're doing it in blood now. And if you were to ask that question a little further, will they show up in saliva? What do you think, Maritza?
I'm going to say yes. Yes.
The answer is a big yes. We're hearing it now. Viral infection, RNA in saliva, antigen in saliva. The only thing that's not coming in the saliva yet is antibody. Okay? And
yeah.
who's doing that? Maritza, who's doing that? We are.
Yeah.
Because we have that tool you saw at our UCLA lab, and we know this underlying principle, and there will be other people coming in as well. So anyway, Sjogren, these antibodies are linearly distributed. So if we find it in blood, we should find it in saliva, and Lord and behold, and we did exactly that.
That's exciting. That's just exciting information. It really
It lit up like a Christmas tree in saliva. What is even more exciting, Maritza, there's a prequel. There's a prodromal syndrome to Sjogren. Pre-Sjogren. Of somebody Sjogren is called Zika. Okay.
Yes.
And currently there's no capability. Test could find out who has Zika. And when we look for these autoantigen in antibody in saliva, the Zika patient all lit up, only in saliva.
So, Dr. Wong, basically, you were explaining how even before someone has Sjogren's, there's
Yes.
what's called Zika, which is basically
Yes.
symptoms are already happening, and what's been happening to this point is that we haven't been able to really pinpoint the disease because we really have a mechanism to do that. So what I'd like to ask you to share with us is tell us about this really exciting technology that is going to allow for doctors to diagnose Sjogren's and possibly other diseases in a much sooner time frame.
So this capability to see these auto antibodies against, these targets in Sjogren, and even its precursor in saliva, it's really an important insight. So that's an observation. But the tool that allow that detection is really one that really is an enabler. Without that, current technology in clinical labs, which is doing it in blood, just doesn't work. We use it for over 2 years, and while it works in blood beautifully, but when you use it in saliva, it's like hitting a brick wall. It just doesn't move that needle at all. But this capability, called EFirm, acronym Electric Field Induced Release and Measurement, which was developed in our lab at UCLA, and it was part of that initiative when the NIH start to credential saliva. They look at all the protein. They also need a tool. It's like a computer needs the software or the hardware, and the marriage between the two is really what will deliver that performance. And that tool is EFirm. And we use that for other applications, but when we realize these immunoglobulin in blood could be in saliva, and we try current technology to look for it, it don't work. And it's a last resort. We say, well, we developed this tool here for a host of application. Why don't we try this? And Lord and behold, a student came in from Denmark. Her dean sent her to our lab for a year, and Sarah, during that 1 year, worked with our engineer at UCLA and brought that to life. And Maritza, that was such a magical moment. And it is this combination that these targets are in saliva, but without this tool, we'll be still in the dark. We wouldn't have known about it, or nor you and I would be this excited about this. So this is really a revelation due to things that you look back and say, well, these dots, how can they connect? Will they ever connect? But if I look back now, is development of this platform, it is Sarah, it is you, and then others that come in the picture here that connects all of these. And it's incredible.
Yes. So for our listening audience that they're listening to all of this, the mechanics, the technology behind it, right. For them, if they are interested or want to know, what does it feel like to go through this test? What do I have to do? Or what does the actual test look like? How does it feel to the patient? What's going on there?
That's, I call it beauty, but it's not that. It is where the true impact, the value, and the utility. The current criteria for lack of a better word, diagnosing someone with Sjogren are 5 clinical tests. You do a blood test, you do a saliva flow test, you go to ophthalmologist to do a tear test, and you do a lip biopsy. You need to have a little bit of your lower lip, take a piece out, and for a pathology look at it. 5 tests. Mm-hmm. And it's the accumulation of these 5 tests and out-of-pocket expenses to come to a clinical diagnosis. It's really not trivial to go through these tests, and having a lip biopsy, it's really not pleasant. The test that we're looking at here, the ability for EFirm to look at these targets in saliva, we're literally talking about a sample of saliva that one could produce, without pain, without embarrassment, if you will. But the most important thing, perhaps, is this, Maritza. It is good. It can see things that blood tests cannot detect. I mean, early detection is good of Sjogren. Okay, we're excited about it. Yes. But earlier, yes. And the earliest, that's a holy grail. And non-invasiveness and good. It doesn't get better.
I mean, no, it doesn't.
it just, and it's unfortunate if somebody has that condition, but if you find it earlier and earliest, intervention is going to come. It will come. If not today, 3 years from now, there's going to be a medication that can slow down the progression. It's going to intercept those that may progress to full-blown disease by keeping them where they are. Okay, and we can monitor them and find them.
And more targeted, because I know that some of the medications that some patients may be on today are actually for other autoimmune diseases, and then we can get into all kinds of side effects and things like that. So the more targeted that we are on a disease, the better we can control and the less side effects. And people that are listening to this are probably just, praising that they're getting this information. So, yeah.
And Marissa, don't forget, 5% of these patients, unfortunately, will develop lymphoma.
Yes.
And that's a fatal sequelae.
Very important. Yes. Very important.
And catching it to halt Sjogren progression is good. It's very good.
Yes.
But earlier detection will also, intervene that cancer development, which is fatal. So it's
amazing.
It's going to do a lot of good.
So where are you now with respect to the test being available or going through any type of, I know it has to go probably through, like FDA approval or things like this. So where are you now with respect to the test?
So we have proof of concept. We have a paper that's currently pending review, and we need to go through, what we call a clinical validation, definitive clinical validation, and then going through regulatory, approval. First is a reference lab evaluation, which we already have that for another application. So for this one here, we would need to go through a reference lab evaluation done either at UCLA or in a reference lab, and that will give us that credentialing and use it as a lab test that someone could send in a sample and we evaluate these targets. And then eventually the next step would be an FDA approval. So that's the regulatory path. And also a path to validate these markers. So that's very well in place. The most important thing to me is Maritza, is that this is where it will go.
Yes.
And this is where it needs to go. And really, of all the years of we've been working on this field in biomarker development, this is really coming together as a very, very impactful outcome, which we're very excited about. Really excited.
And you should be, yes. And do we have a time frame of when we can expect to see this test available? I know it's a tough question.
Well, actually, it's not. I would only say that it's been the technology has been licensed by a third party, and it is in their plan. I would say that this current pandemic has slowed things down a bit,
sure.
but it doesn't sort of detract us from the path that we're moving forward. It's going to happen. Very, very excited about this. And I'm just because it just needs to have that capability to move into a clinical setting and looking forward to people that can be benefiting from having this capability.
So for our listening audience that may be experiencing some of the symptoms you described, the dry mouth, the dry eyes, the different, and they want to know, and they would love to take this test, especially when you were talking about, early detection, lymphoma. How can they be kept up to date on the availability and whether their particular physician, because as you said, this could be used in a primary care setting, it could be used by a dentist, it could be used by an ophthalmologist. We didn't touch on another area which is very important too, with some women, and they experience also vaginal dryness, so this can actually be also maybe even in an OBGYN setting perhaps. So how does our listening audience know when is the right time to ask for this test, or what we can tell them today?
I think for today is the realization that this is here, this is in that pipeline, but the all importance is we need to go through the scientific path, the scientific credentialing, and then the regulatory path. I would think definitive we'll be looking at will requires people to come in and enroll in the trial, and that perhaps is a year away, and you can contact us. You can contact this third party that licenses technology, but it's going to happen. It needs to happen. So currently it's not something that we can do at lab, but as a reference lab capability, I'm looking at Maritza about 2 years from now.
Okay, thank you for explaining that. So earlier in the show, we actually had a patient, Cindy, who actually has Sjogren's, and she also has a cluster of autoimmune diseases. And Cindy had a couple of questions for you, and I was wondering if maybe you might answer them for us.
Absolutely, be glad to.
Because maybe somebody in the audience might have the same question. So one of them you kind of addressed, and it was the question about this particular test being able to have applications in other areas, and you answered that, cancers and other applications. So we got that question, and then she also talked about the biopsy, and you mentioned that this test can even replace having a patient having to go through a biopsy, because she had to have a biopsy done. So for her, it was a really difficult process.
Really?
Okay. She said that she had to have that done, and she wishes that there was something like your technology around. If you want to maybe expand on the biopsy.
Sure. So of the 5 criteria, as I mentioned earlier, that allows physician to make a diagnosis of Sjogren, the 2 most important criteria is biopsy, and I'll come back to that, and the other is looking at these autoantibodies in blood.
Yep.
Okay, which is sort of what took us and refocus it into saliva. So the lip biopsy, the rationale for that is, if you put your tongue against your lower lip, what do you feel there? Do you feel those little bumps?
Mm-hmm. Yep.
Okay, each of those little bump is what we call a minor salivary gland. So we have these major salivary gland here on the side of our cheek, the parotid, the submandibular, sublingual, and however, throughout our lips, lower lips, there are these minor salivary gland, and the biopsy is for the doctor, the pathologist, to take a look at the salivary gland, because one of the cardinal hallmark of the disease, as we mentioned, is the body attacking our own tissue, right?
Mm-hmm.
And salivary gland is that target tissue. So when the pathologist take a piece of your lower lip, of these bumps, what he or she will be looking for is, are there these immune cells, the lymphocytes, are they coming in and start destroying the salivary gland? Okay, so when they look at that, they will have an appreciation: are there autoimmune destruction in this patient? And the degree of these lymphocytes coming in, they can score them. They call it focal scoring, and could classify these patients whether they have Sjogren or not, how severe that process is. So that's an important aspect of the diagnostic criteria. But it's important. But for those of you that haven't had a biopsy in your mouth, be it lip, be it tongue, or be it in your top of the mouth, it's the most unpleasant part of your body. Some of the most unpleasant part of your body is biopsy, and it's very, very painful, and it's just unpleasant. I think that's what it is. But then again, pathologists need to do that. Now here's the thing: I'm not saying saliva will replace any of this test, but I do have that sort of wishful thinking.
That's the vision. That's the vision.
That's the vision. That's the vision. But it has to demonstrate its value. It has to demonstrate it is as good as current criteria or better, and for the buy-in of the community, of the medical community, of the rheumatology community. It's a high bar, but most importantly is if we show the science is credential, the science is solid, that we can detect the disease with extraordinarily accuracy, and even pre-Sjogren.
Yes.
Wow. Yeah. That's if we need a credential there, and that's part of the validation process, and that's part of the reference lab capability to do so. And yeah.
A lot of
very
science.
much looking forward to it.
A lot of science behind it. But just I guess to just put it to the most granular level is that your body is mounting a war against itself. Mm-hmm. There's all kinds of things that are happening, and what the focus is that this technology is going to allow us to detect these diseases so much earlier. So as you said, prevention, because right now, in fact, the last question that I had from Cindy was, she feels like right now it's just basically she's treating symptoms, whether it's for dry eye, dry mouth, it's all symptom relief. Mm-hmm. So she's saying if this was around pre-Sjogren, maybe I wouldn't be in this position. And to wrap up, Dr. Wong, can you basically tell us what hope we have for a patient like Cindy and this test and what it means for them in the future?
I think the most energizing thought about for scientists is the ability to detect these diseases early. The average Sjogren patient have their diagnosis of the disease 6.5 years after the onset of the disease. 6.5 years. This is not even pre-Sjogren. Vanessa Williams, we heard of her when she pulled out US Open, and so the ability for early detection is really key and paramount. And again, the ability to intercept the process, slow down the progression, and then the elimination of lymphoma development is absolutely what we look forward to, but scientifically credentialing it is what is important. And then the ability for, I just want to sort of add this here is people in our community that work on oral health research can integrate and really impact on on chronic autoimmune disease that impact medicine and others, that really I think it's important to make note of. So we're very excited about this. Thank you for having me here, and I really enjoyed talking with you today.
Oh my goodness, thank you so much. And I love the passion in your voice, and I love everything that you shared with us. I think it's certainly exciting news for the future and for all of the technology that you've all been working so diligently and so hard on. So thank you so much, Dr. Wong, and
You're
our
very
listening
welcome.
audience.
Thank you, Marissa.
Yeah, and thank you for offering. If they want to learn more about the research, they can contact you or contact
Absolutely.
UCLA or wonderful.
Absolutely. Give my best to Cindy as well. Thank you very
will.
much.
Thank you, Dr. Wong, for your time today and for sharing such important information. That's it for today, and we'll see you on our next health journey. Support for this podcast comes from Hasty Storytelling. Hasty Storytelling is a creative agency that specializes in production, brand strategy, and live streaming solutions. For more information, visit us at hastystorytelling.com. Health Journeys is produced by Victoria Bilionis and executive producers Dennis Lovelace and Greg Hasty. Finally, if you're enjoying the show, please subscribe, tell a friend, and visit us at hastystorytelling.com.